We all know Z is end of English alphabet, and then in loop A comes, which is the beginning of alphabet. Similarly, when life hits a roadblock with damage to our kidneys, which is vital organ of our body, then survival becomes critical. But if you get timely treatment by a specialist, then you can re-enjoy the life with your loved ones without any complications. Good morning, I'm Mamta, your host for today on ZTalk, a public awareness initiative to educate all of us on how we can protect our kidneys from damage to live a healthy life. Because if our kidney is damaged, then we all know the consequences. In case if it's already damaged or having some infection, then we want to know what we can do to live a normal life. Today, to educate us about what's right to keep our kidney healthy, today we are with famous nephrologist Dr. Ratan Jha, who has been practicing since 30 years and inspiring many young doctors with his teachings and researches. Hello, Dr. Sir.
Hello.
Welcome to ZTalk. What I know is walking is good for kidney. Let's walk and discuss about kidney related issues.
Sure.
Yeah. Doctor, you look so handsome and fit. And can I know what is your secret of your health and your beautiful smile?
It is basically a discipline in life. By the term discipline, we mean that early to bed and early to rise, that thing that we used to be told by our parents in the past is now being forgotten. But I try to use that kind of concept. I go early to bed by 10 to 11 o'clock and get up early in the morning, do my pranayam and manakhamsa exercise, study and eat less and walk more. Philosophy I try to use in my day-to-day practice, which is a busy practice. That means I do a kind of walking for roughly half an hour to 45 minutes a day, daily in the evening. That is the way probably I am trying to keep myself fit.
As I heard that you are doing pranayama and you are doing yoga every day?
Yes. For half an hour I do it in the morning time.
So what is the main importance of kidney in our body? Why we have to maintain it healthy?
Kidney is a very vital organ. It is not only a kind of washing machine that people think that it washes blood, though that is a very important function of the kidney. Kidney cleans the body 300 times a day. Every 5 minutes the whole blood is cleaned. It is an important biochemist, that is, it keeps the chemistry of the blood in the right range. It also produces blood by different hormones. It keeps the bone healthy. It removes the toxins in the form of acid. It is getting removed, and it keeps the salt and water balanced in the normal range. So if the kidney fails, all these things can present with swelling the legs because water is not getting removed, anemia, that is less blood because kidney is not producing blood, removal of salt is not happening, that way it produces high blood pressure, removal of acid is not happening, it makes the bone unhealthy, and this is virtually a poisoning. If the kidney gets damaged, the body gets poisoned, and kidney disease is emerging as a very important cause throughout the world. 10 to 15% of population is having kidney disease of some form or other. So it is a very important disease to be prevented by appropriate means.
What are the main causes for the kidney problem?
In the recent time throughout the world, the three important causes have emerged as the top three. First is diabetes, because we are becoming more and more obese, we are having lifestyle related issues. Second cause is high blood pressure because of multiple reasons. And third thing that is common in our country is a toxin related, that is some kind of contamination of blood, of food, air, or water, which produces kidney damage. That is called CKD unknown. And there are many other causes like genetic disease and some form of inflammatory disease, autoimmune disease, which are less common. So three top causes are diabetes, high blood pressure, and toxins, means drugs which can produce damage, or plant poisons, because we are having pesticides in our food, in the water is also not clean, air is also not clean because of so much of smog, etc., which is producing some form of damage.
Sir, as you explained, they will not aware of other problems, like as they affected with kidney or not. So, will they have any symptoms to recognize that?
The kidney symptoms are quite late to appear. So, we cannot go by symptoms. But if you have to pick it up by based on symptoms, the symptoms are common symptoms are swelling in both the legs, feeling weak, not able to eat. And if they go to doctor, they find the blood pressure is there, anemia is there, itching is there, a feeling of unwellness or not feeling well state is there, etc. So, which has to be checked by different blood reports and urine examination. So, these symptoms are seen when the kidney damage is more than 50%. Before 50%, there are no symptoms. So, you cannot go by symptoms to make a diagnosis. You should try to check in all patients who are at risk of kidney disease, like old people, diabetic person, high blood pressure, taking painkillers for something or other, or family history of kidney disease to pick up the kidney disease in early stage. So, you don't go by symptoms, you go by the risk factor to check. And every person who wants to keep his kidney in good health should have a checkup once a year for diabetes, high blood pressure, blood and urine checkup, which is just not more than 500 to 1000 rupees a check in any person anywhere in the country.
Okay, so they have to depend on the risk, not the symptoms.
Symptoms, you should not wait for symptoms to come in. Symptoms are too late. That means 30 to 70% of kidney function has to be damaged before you get a symptom. So, it is already late. You cannot cure anything after that.
So, the kidney problem, how much effect is there on the heart?
This is a very good question, that people think that kidney and heart do not work together. But kidney and heart work together. That is cardio-renal kind of connection. That is called cardio-renal syndrome. When the kidney gets affected, heart gets affected. So, if you are able to save your kidney, you are able to protect your heart. So, there is a new logo, etc., which has been proposed by certain World Health Organization, that save the kidney, protect your heart, because they are connected to each other.
What about hypertension?
People many times feel that high blood pressure is a disease of heart. But one has to realize that this is a disease of kidney. When the kidney is not able to remove salt and water in a proper amount, it produces hypertension and produces damage to the heart. So, high blood pressure is a very important risk factor for both kidney damage and heart damage.
Doctor, does kidney problem will have a vital effect on our heart?
Yes, kidney problem can affect the heart, and this is labeled as cardio-renal syndrome. For that means heart and kidney are connected. The heart gets affected because of kidney problem because of three reasons. One is the blood pressure effect. Other is the anemia effect, that is blood is less, that also affects the heart. And third is the water and salt overload, which produces a kind of indirect effect on the heart. And there are many other things which also affect the heart, like toxins, acidosis, etc., calcium, phosphorus disturbance. So, it's a very complex interaction between heart and kidney in a patient who has kidney disease. And this will present as breathlessness or not able to breathe properly, chest pain, sudden cardiac death. These are the ways the kidney can affect the heart in a patient, and that can lead to increased death. So, we need to treat the kidney disease in a serious way to protect the heart as well as the life of the patient. The high blood pressure in the kidney disease is because of too much of water retention, that is body not able to remove the water and salt, and with some other kind of things which changes, which produces a kind of high blood pressure.
Doctor, how hypertension and blood pressure will affect the kidney?
The hypertension affects the kidney in two ways, that it produces a kind of vascular damage in the kidney. So that when the vessel gets affected because of pressure, the kidney starts suffering from the lack of blood, and ultimately kidney not able to filter it. That is simple way to say that how the kidney suffers, that the blood which is getting into the kidney is not getting in sufficient amount. And once it is not getting sufficient amount, it is not getting filtered, and that the toxin gets accumulated. That is called ischemic kidney injury or hypertensive nephrosclerosis. But high BP can also affect the heart also, because heart has to pump blood against pressure. Initially it becomes muscular, that is called left ventricular hypertrophy, and later on it fails, that is produces dilatation on the heart, and it produces a kind of heart failure. So high BP is both bad for kidney and heart, And many times you are not sure what has produced the high blood pressure. Is it because of kidney disease or is it because of high blood pressure? But most of the time it is because of kidney, because kidney is removing salt and water. That is the basic function of kidney, etc. And when it is failing to do that, it produces high blood pressure.
Sir, as you told, like many unwanted food and medicine will affect our kidney. If I'm on medication, which I'm taking for other health issues, problems, like how can I protect my kidney?
Most of the patients who are having kidney disease get treatment for the basic reason what has produced the kidney damage, like blood pressure, diabetes, or an autoimmune disease where you give steroid, or sometimes the cancers are there for which therapy is given. So that is the basic therapy. Other therapies are for changing the risk factors, like most of the patients will receive therapy for cholesterol because they are having a lipid disorder. Many patients will require treatment for anemia with iron therapy and hormone therapy to raise the hemoglobin. Few patients require therapy for the sodium and potassium disturbance. That is because they are not able to handle that kind of thing. So these are the general therapies which we give in addition to symptomatic therapy. Like many people have itching, lot of itching because of the toxins which are accumulating in the body. Many people require therapy for swelling in the form of some tablets to reduce the swelling, etc. So some therapies are for the basic disease, some therapies are for symptoms, some therapies are for taking care of the risk factors like cholesterol. So the simple catchy slogan is ABCD for therapy. A for hemoglobin A1C because most of the patients are diabetic who are having diabetic kidney disease. B is for blood pressure control. C for cholesterol control. And D for diet. Diet will mean that you should give a diet which is reasonable for the patient, where calories are enough as well as the protein is restricted in many situations, along with less salt. Salt is considered to be a poison for patients who are having advanced kidney disease. So these are general concepts. Water is also very important, that how much of water to take. Many people think that taking too much of water is good for health, but that may not be the case. We tell the patient that if they are having swelling, to reduce the water intake to 1 to 1.5 liters. If they are not having swelling, at least 2 liters of water to be taken. And if they are feeling very thirsty, 3 liters of water can be taken if the swelling is not there. Taking water beyond 3 liters has got no extra benefit other than you have to keep on going to the toilet to pass urine. So we tell the patient there is no point taking more than 3 liters of water unless they are having kidney stone, where people say take 30 more water.
Doctor, few patients may reach you directly, or like they may go to local doctor after diagnosis there and they will come to you. Delaying and reaching the right doctor, will it create any life-threatening problem to the patient?
This is a important concept, that people who come to the kidney specialist late, they do not have a good kind of outcome. They reported that those who need dialysis and coming to dialysis for the first time to a nephrologist, there is no preparation. So they are not mentally prepared, financially prepared, and they do bad on dialysis, etc. So it has been recommended that people who have lost kidney function to the tune of 30%, they must visit a nephrologist if it is available, to improve the quality of life as well as the quantity of life, because that means that they will have a longer life if they get better managed. So that is the simple answer, that people should report to a nephrologist when a disease can be treated adequately, when the GFR or kidney function is to a lower level of 30 ml. Before that, any physician can treat the disease adequately if they know how to treat it, etc.
At what stage do you decide whether a patient needs transplantation or dialysis?
So this is a thing that many people ask. We dialyze the patient for 2 reasons. One is called a temporary kidney failure, which is called acute kidney failure or acute kidney injury, where a person will require dialysis for a short time, like following dengue or COVID infection or malaria or some kind of poisoning. They recover with a support. So that is not a long-term dialysis. Other form of dialysis is called chronic dialysis for chronic kidney failure, where a person has to receive dialysis lifelong unless they go for kidney transplant. So this happens when the kidney function has fallen below 90%. That is 10% of function is there. Then they require dialysis, and then if they are fit, they can go for kidney transplant, which could come from 2 sources. One is from the related donors, family donors. Other is from the dead body, which is called diseased kidney donor or cadaveric donor, which is happening in our state with the Jeevan Dan program promoted by the state machinery.
And so what are the food items that helps our kidney health?
There are certain food items which should be avoided. That is the most important thing. Whatever we eat should be a kind of healthy diet. By the term healthy diet, we mean that the calories should be not more than 30 to 35 kilocalories per kg body weight. Means if you are not overweight, this is the calorie to be given. Protein has to be taken in a reasonable amount. Taking high protein diet is not good for kidney in general. We said that you should restrict the protein, particularly the animal proteins, etc. These days people say that take plant proteins, because plant proteins are good for health in general, and anything in excess more than 1 gram per kg body weight of protein is bad for kidneys. These days we see many people taking lot of protein to build the muscle mass. Though it may build the muscle mass, but it could be detrimental for the kidney, etc. Salt is a very important concept in the diet. People think that pink salt, rock salt are safe, but it is not the case. You have to reduce the salt intake. You should not take more than 5 grams of salt. Avoid papad, chutney, achar, etc., which are bad for kidney patient because it increases high blood pressure. Fiber is very important. That will mean that we have to take more vegetables, appropriate fruit in case potassium is not high with kidney damage, not very severe. You can take 1 fruit a day to keep the fibers in the right amount. So diet means calories, protein, fiber. Fat, it is said that you should take less amount of fatty food. People only go for safflower oil or sunflower oil. That may be good in general, but if you do not take the other kinds of oil like mustard oil or ghee, we are deficient in certain things. So you should take less amount of fat and balanced kind of fat, etc. That you should take some amount of ghee, some amount of mustard oil, some amount of safflower oil to have a compensated kind of diet. So diet should be good in composition, more plant food, less amount of salt, less amount of fat, and not to go for animal protein in general in excess amount. It is said that as the kidney becomes old, you have to take less amount of animal food because it produces more acid. So this is the concept that we are changing from a non-vegetarian food to a vegetarian food throughout the world to protect the body, and it is good for the kidney in general.
People who are suffering a lot with the kidney problem in their daily routine, what they must avoid?
The thing that is to be avoided is not to take too much of salty items. That is a common thing, like junk food. People take a lot of junk food these days, the young generation, that is bad for health in general. Less amount of fatty food, etc. Like samosa they may look good, but it's not good for kidney in general, etc. And for the heart also, that is there. And less amount of calories, that you should eat less and walk more. So that simple statement, eat less and walk more, will be helpful not only for the kidney but for heart and for health in general.
Doctor, what is the final message for our ZTalk viewers, how and why they should maintain their kidney healthy?
The first message for your viewers is that you should love your kidney. Like many times we love our heart but not the kidney. So we should love our kidney. We have 2 kidneys, but 1 kidney is sufficient to keep a person healthy and alive, and that's why we go for a kidney transplant, where we donate a kidney from to our near and dear one and remain healthy. Kidneys have almost 10 lakh kind of filters in each, which is called nephron, and as we are taking care of nephron, we are called nephrologists, and we are a kidney physician, and we are different from urologists who are the kidney surgeons. So the message is that keep our kidney healthy by few things. Diet should be appropriate. Sleep is very important, because we feel that these days in the recent day world, because of stress, we are having less time for sleep. It is said that 6 to 8 hours of sleep is important to keep the whole body in health, and including the kidney. So diet means less salt, less kind of fatty foods and junk foods, less amount of any amount of salty addition. Fluid should be adequate, 2 to 3 liters per day, and sleep should be good. This is covered under the heading of lifestyle changes. Then avoid painkillers, avoid herbal therapies or therapy which are claimed to be safe for every situation and cures every disease, because that is one of the common causes of kidney damage. And treat the basic 2 risk factors of high blood pressure and diabetes by proper evaluation every year in case you are not having it. Get the blood check in the form of urea, creatinine, and urine check for protein and RBC. And if required, ultrasound. So the whole kidney checkup is not costing more than 1,000 rupees, and this is a good way to screen the kidney disease in people who are having in the family diabetes, high blood pressure, or kidney damage. So love your kidney, save your kidney, and if you save your kidney, you protect your heart. Eat less and walk more to keep your body fit. Thank you.
Thank you, Dr. Ratan Jha, for your valuable suggestions and guidance. It will definitely help our viewers. Thank you for your precious time to be part of ZTalk, which is an initiative with Indian medical fraternity to make people more and more aware of problems of kidney diseases. Surely we will follow your guidance and suggestions to keep up our health in kidney and every part of our body very nicely. Following all your suggestions and good diet, we all love our kidney. Thank you so much. Thank you, viewers. Do like, subscribe and follow ZTalk page on YouTube and Facebook. Thank you so much.